Have you ever had surgery and you woke up in recovery and you were cold and you were shivering and you were like, why am I so cold? Well, when patients undergo anesthesia and they undergo surgery, they are given an anesthetic gas that alters the hypothalamic thermoregulatory curve. And basically what that means is in normal conditions, when you're not undergoing surgery and you're not being given these gases, our bodies have a very narrow range and response to changes in temperature and changes in the environment. And that range is usually changes of 0.2 degrees Celsius before our bodies start to either vasoconstrict and shiver or vasodilate and sweat. But when we give an anesthetic gas and we shift this autoregulatory mechanism in the hypothalamus, basically what these anesthetic gases do is it creates a wider range before our bodies can compensate and even respond to these extreme changes in temperature. So this range usually goes from 0.2 degrees Celsius to about 2 to 4 degrees Celsius before our bodies even start to vasoconstrict and shiver or vasodilate and sweat. So basically what this means in the OR is, as we all know, the OR is usually kept pretty cold. So anyone that walks in there is probably going to be a little chilly. And then on top of that, you get a patient that's having surgery and you give them an anesthetic gas and shifts this thermoregulatory curve. It's going to be very easy for these patients to lose body heat. So it's very important that as anesthesia providers, we do everything we can to try and preserve body heat and prevent heat loss. And that's commonly why you'll see your anesthesia provider put the bear hugger on you or the forced air warmer and blow warm air or use warm blankets to try and preserve that body heat. So when you wake up in recovery and these gases are leaving your body, that range that had become wider because of the anesthetic gases is returning to its normal state, I guess you could say. And you're gonna feel cold, you're gonna start shivering, and your blood vessels are gonna constrict to try and preserve body heat. And that's also important for patients to let their anesthesia provider know or their nurse know in recovery if they are shivering, because it can do things like increase metabolic demands, it can alter pH and acid-base balance, and it can affect a bunch of other things. So that's why it's important to reduce shivering, reduce metabolic demands, and prevent heat loss, especially in cardiac patients when we are wanting to limit myocardial oxygen consumption and keep that nice balanced supply and demand of oxygen supply and consumption. But yeah, that's a little bit behind the mechanism of why you feel cold after surgery.